as ever, a highly polished performance, the Q&A is. But you're very welcome to this week's session. Remember to tell your mates, people that you're working with, that this is open to all staff. And it's a really good opportunity to get to have a conversation with you all. As ever, format is the same. I'll do a brief summary update on some of the highlights, and then we'll go into some questions that have been already submitted. And then, as ever, people can feel free to put questions into the chat. And we're not always able to answer them all on the hoof, but we will get back to make sure there is a response within the week. Today I'm joined by the very excellent Anne-Marie Newham, Director of Nursing, AHP and Quality, and the equally excellent Lorraine Hooper, Executive Director of Finance, what else? Estates, Facilities, Digital IT, and Yolanda Martin, who's grinning at me, our Associate Director of Communications and Engagement. So, again, the other thing just to mention, we'll mention at the end as well, we're moving the timing of this. So from this week, we're going to go to fortnightly. So the next one will be in 2 weeks' time, which by my maths is 5 + 4, 19th of May. And this new start time of 1 p.m. Okay, without further ado, very briefly, all things pandemic and vaccination programme. You'll notice that nationally the numbers that continue to go in a really positive direction, number of new cases. Nationally, I think it's fairly static, around about 2,000 a day, but the number of admissions for people that are seriously ill nationally continues to fall, and as does the number of deaths within a 28-day of a positive test. So that's all really heartening. And much of that is mirrored within the county and mirrored across the organisation in terms of staff absences, outbreaks, etc. So that's really good news. And to say a huge thank you to everybody. Everybody's making their own individual and team contribution to that picture within our organisation and more broadly, and is recognised that the massive contribution that all staff are making to this endeavour. So thank you very much on behalf of the board. In terms of the vaccination programme, again, the national numbers good. The numbers within the county are good too in terms of first doses, second doses. You'll have read, I'm sure, about the supply issues nationally. That continues to be a challenge to manage. So we are at reduced capacity around being able to provide all the first doses that we'd like to provide. Again, that's not just a NOTS problem. We are having to prioritise to make sure that people get their second dose within the 12-week period as stipulated, which we're able to do. The other pleasing news is that the gap between those vaccinated and in the upper quartiles of social deprivation, the white population, the gap between that and the black minority ethnic populations is closing. So that the vaccination team has been informed by the data. And for example, the vaccination bus that I spoke about in previous weeks has been really successful in getting into the heart of some local communities and enabling those citizens to avail themselves of the vaccine, which is really, really good news. And for our staff as well, you haven't missed the bus, both metaphorically and in actuality, that there's no date set that if you're a certain age you have to have had your vaccine by then. There are still slots available if you for whatever reason been hesitant or not been sure or waiting a bit longer. There's still slots that you can take up and get vaccinated. So that's so much I want to say about COVID and vaccines. Then a little bit about, okay, so what are we getting on with? There's a real sense, isn't there, of getting back to some sort of business as usual. I know, for example, Lorraine and her team have been sweating over the financial and business planning for the year and getting all that signed off, which is a traditional part of the NHS cycle of business planning. It's a little bit late because of COVID this year, but it is what it is. We're starting to pick up some of the work that's been at the top of our list. So, for example, we've had conversations within the executive team and at board about the culture and values work that we've been doing, that we've started to see some really good impacts of that, the restorative and just cultures work. And we'll be picking up the threads of that with divisions and directorates about, okay, what does it mean for us? How can we use this support to continue to support our staff, develop our teams and improve the quality of experience and outcomes for patients. I just wanted to say a couple of specific things, and then I'll hand over back to you, Yolanda. One is around the National Staff Survey, and I know I mention this on a regular basis because I'm not sure whether you heard, we did quite well the last year gone, but there's an important part of so what? So what does this mean? And we've had some really good initial discussions, and we started some engagement events with specific teams across the organisation. The first thing is to check with everybody that we've got the main themes and issues and priorities identified, and we think we have. We've gone through, or going through with a fine-tooth comb, the written feedback in the National Staff Survey. We had, I think, over 6,000 lines of commentary, and we're picking the main themes out of that. And once we've done that, there's a really important component of making this part of the everyday, so that it's not seen as something that we're just interested in for now, because this is a fundamental part of what makes an organisation a good place to work and what improves the quality. And you'll see that increasingly under the banner of "You said, together we did." Whether it's setting up the health and wellbeing service, expanding that offer, and supporting career development opportunities, things like that. And so it's going to be labelled so that people can clearly see the link between raising issues, giving us feedback, and a response. So not only watch out for that, but get involved too, because this is as much your programme as it is ours. And then the second thing, related but different, is I just wanted to flag something that Anne-Maria and her team have been picking up relating to closed cultures. And I wasn't sure whether I'd mentioned this in detail in this forum previously. So this is a term that it's been around in the literature for some time, but the CQC particularly are interested in it, and they've in one of their recent unannounced visits here have identified a concern around some of our teams being quite closed off in their culture of work. And sometimes it can be quite a fine line between having a really tight team that works well, is autonomous, gets on with good outputs and developments, but eventually becoming, for whatever reason, too closed off, where it starts to fall behind what's good practice and starts to become a bit defensive, and there's like nothing to see here sort of thing. And that can be quite A, difficult to spot, and B, difficult to do things with. But if left, it can result in some poor experiences for both staff and patients. So we're starting to just sort of raise the profile of this, that the important thing is to be able to recognise it. And it's not so that we can come in and say, oh, this is terrible, you're doing a really bad job, but just let's start the conversation, because the important thing is how you respond to knowing that or thinking that it may be apparent. So it's just to sort of put it there in your heads, and perhaps have conversations with your peers, back to your teams about, heard about closed cultures. What's our situation here? Do you think we might have an issue with this? What's it like to be on the receiving end of our team? And if you start to ask these questions of yourselves, it can be a really powerful catalyst for thinking, oh, actually. And if it does start to ring some bells, then we've got a resource available to support teams to move forward with that. So just a couple of examples of the sorts of things that we started to pick up and work with. So that's me done with Yolanda by way of introduction. Thanks very much.
Thank you very much, John. I'd just like to start by saying a big thank you to Alex, who's been the MC since we started these back in, I think it was December time. So thanks, Alex. And if I do half as good a job as you, I'll be pleased. I'm not very good at clicking on the mute button and the camera button, so I'll try and remember that. The first question, Lorraine, is for you, if that's okay. People are asking, when will the extra days leave be added to ESR?
Thanks, Yolanda. So I'm Lorraine Hooper, I'm the Director of Finance, Information and Estates for the Trust. The extra day is currently being added by the ESR team. Unfortunately, it's a manual process. So they've got to manually go through to carry over everybody's annual leave for last year, and then they've got to manually go back through those same 10,000 staff again and add the extra day's leave. So it has taken them a little while, but over the last few days, emails have started to go out to team leaders and those who are supervisors in ESR to start to be able to tell them that those days are now present in ESR for their teams. So it is happening. And it is there for staff to be able to take. It's taken a little bit of time to work through ESR, but it is being done.
Okay. While you're still sitting in the hot seat, Lorraine, I saw you were keen there, switch your camera off.
Damn it.
I'm going to ask you one on finance, and hopefully, as that is one of the titles in your title, then you'll be able to answer this. Someone's put in a question about how we did as we start the new financial year, or a few weeks into it now, but how did we do last year? And please make it in simple terms for those of us that don't understand finance, Lorraine.
I will do my very best. So as we came out of the last financial year, so the period from April the 1st, 2020 to the 31st of March 2021, we had a surplus. So our income was in excess of our expenditure by £2.6 million for that year. Now, as you'll all know, that whole year was in the middle of a pandemic. So there were some different financial arrangements to those that we've been used to historically, namely that we didn't do the traditional CIP. There wasn't a requirement for us to do the traditional savings that we might make, and also we claimed lots of income from the Department of Health for those costs we incurred in COVID, things like PPE, the establishment of the vaccination programme. So it was really good that we managed to maintain a grip on our finances at the same time and understand what our expenditure was doing. As John said at the beginning of this, we've been beavering away planning for what it now starts to look like as we come out of the pandemic. That includes significant things in the future, in the year ahead, significant investment in areas like mental health, things like Surge. We are also, of course, going to open Sherwood Oaks this year, so there's a significant investment in our capital plan. So we're making sure that we're focusing lots of effort on making sure that we understand what all the costs are associated with all of those developments as well, and understanding what returning to business as usual looks like, if that even is a thing anymore. We're starting to understand what the world post-COVID looks like, so that's occupying quite a bit of my time at the moment.
Thank you, Lorraine. A really good comprehensive answer there. Moving on to things COVID, Anne-Maria, and the next question's for you. We've been asked the question, and I know that you know the absolute answer to this. I've had the first and the second COVID jab. Can I stop doing lateral flow testing now?
So, you didn't hear me groan. Well, actually, to be honest, quite a few people have asked that on Facebook, and I've had a few people ask me that when I've been walking out and about. The simple answer is no, you can't stop, and you shouldn't stop. The reason I say that is there's a couple of things really. That it is still picking up asymptomatic staff. What I mean by that is that some staff are still catching the COVID, even though they've had 1 and 2 jabs. And even if they've had COVID before as well, we've had some staff that have caught COVID for the second time. They're not as poorly. You're not as poorly if you do get it the second time, but you are still able to transmit it to other people. But it's really, really important. I mean, that is why the government are now rolling it out. That's why pharmacists are offering it free. That's why the government are putting it into education. So I'm saying a big plea. All staff that work for the trust and are coming into a clinical or an admin base who are coming into work, you are able to have a LFT lateral flow kit test box to do your testing twice a week, and then really importantly to record it. So the simple answer is please, please, please keep going, even if you've had your jabs.
Thank you, Anne-Maria. I have got some more COVID questions, but I'll refer those to John. There's just been a comment in the chat about the ESR team. Just to say thank you to the ESR team for the mammoth task that is adding in the extra day of annual leave. So, moving over to you, John. COVID restrictions are easing, so should I be returning to the office or site now?
Yeah, thanks. So there's not a simple answer to this one, unlike Anne-Maria's question, which was really easy to answer. This is more complicated. Sorry, I made myself laugh there. That's ridiculous, isn't it? Yes, COVID restrictions are easing. Yes, we talk about on a regular basis, don't we, picking up threads, back to business as usual, and that would imply coming back into work, inverted commas. The important thing about this is that it is going to be quite complex, and we need to make sure that we've got the offer right to all our staff in their various roles and in their various geographies to support them to come back into their roles. And I know I've said this before, but I think it's probably worth reiterating that some of those things will be fairly straightforward, won't they, in terms of if you've got a full-on clinical role that requires you to be in, say, for example, a ward, then I think that describes itself. There are equally some roles that are predominantly administrative that could be done from a home base or a different base to what might be used previously, and then there'll be a variety of roles within the middle of those ends of the spectrum that perhaps a bit of both, or there's a sort of mixed economy, and teams are busy working up descriptions of how that would work. And I think there's a few principles, aren't there, to make sure that we adhere to that. Some of them are sort of describe themselves. So we're here to serve patients, service users, carers, and we need to make sure that those services remain accessible with whatever modalities work best. We need to make sure that we continue to support our staff in their health and well-being in terms of whatever we can do to reduce the chances of COVID infections, so that the facilities need to be COVID secure. But there's other considerations. So, for example, one of the things that we know makes people positive about the job they do is belonging to a team. There's a literature supports that people don't often leave organisations; they leave teams. Whilst working from home might suit a lot of people a lot of the time, we need to make sure that we don't get disconnected, or they don't get disconnected, and that we create an offer that enables teams to meet. It's that water cooler conversation, isn't it? It's well, I share the executive. You know, the executive likes to get together now we can in person in a COVID safe room wearing masks, because there's that non-verbal, there's that being together, there's a bit of chat that contributes to your whole work experience, and we need to make sure as we describe that going forward, that's all in play, as well as learning the lessons that we've learned through the pandemic too. So I hope that sort of covers some of the main points of that, Yolanda.
Thank you, John. Sticking with a question along the same sort of theme, somebody's mentioned about the home working policy and whether that's available yet on Connect.
So I have an answer here, but I know that Jen Guy was on the call. She might want to add to it because she knows far more about this than me, probably. That's not hard. The home working policy is being ratified imminently. Went to senior leadership last Friday, goes to the Trust Partnership, Staff Partnership Forum on the 10th of May. So that's the timeline. So by mid-May, it should be ready to go. I don't know, Jen, if you want to say any more about that. Afternoon?
Hi, just getting the lights right. Yeah, nothing more to add really. We've it's been quite complex in terms of just making sure we cover everything off that needs to be covered. But yeah, almost ready. My colleague Nikki Welsh, who's also on the call I saw earlier, is doing the final amendments this week. Just had some email exchange of her this morning on that. So yeah, should be approved soon.
Great stuff. Thank you.
Thank you, Jen. Thank you. And so I'd like to move over to Anne-Maria, if that's okay. This one, Anne-Maria, is about recruitment. So somebody's asked about the £500 reward, whether that's still available for recommending someone to work at the Trust. And if so, where can they find further information?
Yeah, so it's an interesting one. It is still available, very much still available, but we've never had very good or very much take up of it. It applies to if you are referring a clinician at a band 5 or a band 6 level, then it absolutely does apply. As long as they stay in post for 3 months, then you get your £500. And if you want to know more about it, there is a link called Refer a Friend Scheme, which is still in operation on Connect. So yeah, it's still in place. And if you know any band 5s or 6s, clinicians, absolutely.
Thank you, Anne-Maria. That's useful. And the next question is one that I'm going to use chairman's privilege and answer myself. So somebody's putting a question about whether we're doing anything for Mental Health Awareness Week. Tempted to say, no, we can't be bothered. But actually, we're doing absolutely loads right across the organisation. We've got lots of activities going on. The Mental Health Foundation are the supporting organisation, and the theme this year, is nature. And we've got loads of colleagues right across the whole Trust who've been sending us in loads of stories about how connecting with nature's improved their mental well-being, and obviously the impact that that has on the well-being of our service users as well. So lots of us are outdoorsy types and we'll all be sharing our stories. Now this fills me with dread. Wild swimming in the cold weather that we've been having, I don't think so. Hiking and gardening. And we're just going to be promoting everything across all of our channels about how our staff and colleagues use the great outdoors to inspire and support our patients and service users. We're also working with colleagues across the system, so in the local authority and our other NHS and other care organisations, on a social media pack for the whole week, including some case studies. And we're taking part, well, John is, in a ministerial visit to our mental health support teams on Monday of next week. And we've also got the BBC Radio Nottingham Happy Heads campaign that we're working on with them. So that's a quick summary of what we're doing for Mental Health Awareness Week, which is next week. So that's that. And then I've got quite a detailed question, John, that I sent to you, moving back to the COVID theme. Somebody's picking up on the fact about the vaccine bus, and you referring to some anti-vax protesters. So I just wondered if you'd be happy to say something about that, please, John, if you wouldn't mind.
Yeah, thank you. I just seen Neil Thompson's comment in the chat about wild water open swimming is good for you. I'm not so sure it is actually, but
we'll let Neil try it out and give us his verdict.
Yeah. So yeah, this is one of those things that I think it's really important to share with you, because I suppose it's a sign of the times, really. So and I'll read it to you. So the last Q&A, John referred to anti-vax protesters who visited the vaccine bus. This is factually inaccurate. The people who came to speak about concerns were with these specific treatments are not anti-vax and did not protest. They are pro-safe vaccine, pro-transparency, pro-medical freedom, and they want to speak to citizens about their rights to be informed. There were no anti-vax sentiments expressed. It's troubling that John would attempt to discredit legitimate concerns about these unprecedented treatments. I'm not going to go into and then there's a whole lot of quite detailed questions about the vaccine content themselves, which people are perfectly able to look up. But so I refute that statement. We've got testimony from a number of staff that have been working on the vaccination bus that were, I would say, verbally harassed by anti-vax protesters who masqueraded as patients, got onto the bus and were verbally intimidating staff that were trying to do their job. And I think it's really important that I state that, and that the organisation states that we don't think that's acceptable. People obviously have a legitimate right to protest peacefully, but intimidating staff going about their job, I don't think is acceptable. So I don't think that's, well, I disagree with that statement, but I think it's important that we have the conversation, because I think it's important that we talk about these things, and that we're grown up to have an open debate about it. But I just felt I needed to put that on record. Yolanda, thank you.
Thank you, John, for clarifying that. Just going back to the outdoorsy types, there are lots of comments, absolutely loving them, in the chat for today's meeting about whether it's a good thing or not to be wild water swimming. So yes, differing views, and I'll let everybody read those because there are far too many to mention. And then thank yous, John, from a few people as well for supporting our staff in going about their business. The last question, I'm sure that is the last question, is one about Impact, the provider collaborative, mentioning that they haven't seen an update for a while. And just wondering if you could give us a bit of an update on the Impact provider collaborative, John, please.
Okay, so I'm not sure how much people know about Impact provider collaborative. So it's slightly embarrassingly, it does stand for something, but I can't remember what it stands for. But it is about the provision of adult secure services. So forensic services, medium and low secure, across the East Midlands patch, for which there is a contract with NHS England specialist commissioners for all of those services, and Notts Healthcare won the contract to become the lead provider for all that business, if you like. Sorry to use the term business, but essentially it's provision of those services across the 5 East Midlands counties. So that's Lincs, Notts, Derby, Leicester and North Hants. And within those 5 counties, there are 9 different mental health providers, of which we are one. And that is the provider collaborative. so the 5 NHS trusts, and what makes this unique is that the 4 other providers are independent sector. So places like St Andrews, Elysium Healthcare, and a couple of others. And together we use a model of provision that looks to use an identified amount of commissioner money to provide outcomes for patients with the principle of improving outcomes, improving efficiency, and tackling health inequalities. And it's part of a national programme. There are, I think, 4 or 5 different flavours, if you like, of, and it comes under the banner of new care models. So it's those services that are relatively low, I use the term cautiously, relatively low volume, but high cost. So they're forensic beds, they're children and adolescent mental health service beds, eating disorder services, and others will be coming on stream. So this has been live since October of last year. We're one of the vanguards nationally. So from an organisational perspective, we are sort of treading new ground really, and I've had a lot of support and interest from national and regional teams for how we do this, because it's a very different way of doing business to previously working with specialist commissioners. Providers are now, inverted commas, overseeing and running this, with the sort of proviso that money saved due to that improved quality and efficiency is reinvested to develop the services and improve the experience and outcomes of patients, and also an expectation that there'll be a drive down from using the very sort of expensive high-end beds to developing community services and alternatives to admission. So it's a very exciting space to be in. It's a bit of a cliche, it's a marathon, not a sprint, and you can imagine the governance that underpins all this, because we are accountable, and we're accountable for the performance, the quality, the money of all those other organisations by holding the contract. And so our trust board has to make sure that it's got the right systems and processes in place to oversee that, whilst also being a partner, and that can be quite tricky. So we're sort of treading carefully to work out the best ways to do that. I think the question itself is spot on, because whilst we've been absorbed in making sure that we get this set up right, it does flag that actually I think we've been a bit invisible in sharing some of that with people across the trust, in terms of the learning, the positives, negatives, developments, next steps and stuff. So note to self, we'll start to make sure that we highlight it a bit more in future. And a number of us could talk for a long time on this, because it is an interesting, exciting area. But we'll make sure we include it in other fora to keep people sighted on it. Hope that's a helpful sort of starter, Yolanda.
Thank you, John. Just looking at the comments and things that are in the chat, Simbi's put a comment in saying thank you to Anne-Maria and John for emphasising around COVID guidance, as some staff have raised concerns about reluctance by other members of the team to adhere to PPE guidance and to wear masks. And then Lynn Walker has put a comment in relation to Nature and Mental Health Week. Please can people link in with the Energy Environment Department at the Trust, so that we can promote and share ideas on maximising access to Trust green space for patients and staff, which is a great idea. It's an objective within the Trust biodiversity and green space strategy, which is available on a link. And then Hanny has asked a question about, and Anne-Maria, you've liked it, so I'm going to come to you for that. About the price of drugs, and whether we can have a regular list, or where they get information about how to save money on some drugs.
Yeah, no, I thought it was a really good. The reason I liked it is because I thought it was an excellent suggestion, and I'll raise it with Matt Ellswood to see if that is something that we can do, because I think that he makes a really good point that in as a matter of weeks you can save a couple of £100 on each drug. He's absolutely right on that. So I think it is something we should provide staff with. So I think it was a good one, Hanny, that was.
Thank you.
Thank you, Hanny. And then Neil's put a comment in, Neil Thompson's put a comment in about the Protection of Emergency Workers Act, and we should be making greater use of this to get the message across to everyone that assaults or abuses NHS staff or other emergency workers. Suffice to say, Neil, that the police have been called and charges are being pressed against at least one individual, so, and others had cautions. So we are taking that very, very seriously, and it's not just our staff, it's staff right across the system. So thank you for that. I think that's everything, John, that we've got. So I don't know whether you wish to say a few wise words to close off today's session, please. Thank you.
I don't know about wise. Good conversation. Thanks for everybody's contributions. Just Lynn's point about Lynn Walker's point in the chat about the sustainability. The trust is doing some great work across that sector in terms of sustainability. We're part of the Sherwood Forest Plant a Tree thing. I planted a tree, I think planted two a few weeks ago with some goats in Wells Road Centre. But joking aside, there's really good evidence of supporting, and we joke about wild sunning, but getting out and about in the fresh air, nature, supporting health and well-being is a really good thing to do. And we've got some great aspects of that through these sorts of endeavours. Lynn's team specifically around sustainability. It's a really good thing to get involved in, and as an organisation, I think we're in a really good place. That's probably as much as I want to say, other than thank you again for everybody for what you're doing. I'm just a bit diverted because there's lots of stuff coming in the chat, Yolanda. I'm not sure whether I've missed anything before we finish.
I think Jen's giving a plug to the new recruitment microsite that we've just recently created, which is absolutely fabulous, and she's put the link in there. But she's also asked a question about what would you say to encourage people to come and work for us?
Yeah, it was really with goats. They've got goats at Wells Road. One of them's like a small horse. But to finish, did you see that there was a farmer up in Yorkshire who, in the middle of the pandemic, noted that people came to stare at the goats and they found that they were sort of stress relieving. So she opened up a Microsoft Teams chat line where you could book a call with a goat, and she made, and you had to pay, and it made 50,000 quid. It was on the radio, so it must be true. I'll leave you with that thought.
Thanks, John. Thanks everyone for dialing in. See you all in 2 weeks' time.
Fortnight. Cheers.